I started treating sleep disordered breathing and sleep apnea in adults almost 9 years ago. It became a passion of mine because I wanted to go to medical school, but then I recognized that my talents could be better utilized in dentistry with the artistic aspect too, and realized I could have the best of both worlds by treating the whole orofacial anatomy. So I started treating sleep apnea in adults. It's been extremely rewarding. I've gotten, spouses back in touch with each other. I've improved the health of patients who otherwise may have had major life-altering chronic diseases. And most recently, I started screening and treating sleep apnea in children. That became a passion of mine because 2 of my children have suffered from airway disorders. One of my young boys was affected in terms of his behavior. His day at school was significantly altered in a negative way. He was having accidents at night and I knew he wasn't himself. And I also recognized that I couldn't treat sleep apnea in adults without trying to prevent it in my young pediatric patients. So that's become a huge area of emphasis in our practice and a passion of both mine and my team members. In all of our patients, we do an oral cancer screening. As part of that, there's naturally an airway measurement and assessment. And so we're screening for sleep disordered breathing, gastric reflux, oral cancer issues in all of our patients every time they see myself or one of the hygienists. We're also fortunate that we get referrals directly from ENT and sleep doctors in the Des Moines metro area who have maybe recognized the limitations of their treatment, or they have patients who are CPAP intolerant and they want to know something else that we can do from a dental standpoint. Sometimes it might be somebody that could benefit from orthodontia to widen the arches and allow for anterior placement of the tongue just to get the soft tissue out of the airway. Sometimes it's as straightforward as making an oral appliance that a patient wears at nighttime to decrease their snoring and open their airway. We work very closely with a team of orthodontics, ENT, sleep disordered breathing and sleep doctors, so we can take a full team approach, make sure we're getting that patient healthy. And almost all of us will also have the conversation about diet and exercise as a modality for decreasing maybe the category of sleep that they're in and making them healthier and improving that airway naturally too. If you or a loved one are suffering from snoring, sleep apnea, sleep disordered breathing, or any other airway health issues, contact our Urbandale, Iowa practice.